Hi everyone, this is Dr. Uduak Lectures. Today we'll be talking about epilepsy. Epilepsy is a disorder of the central nervous system that is characterized by paroxysmal cerebral dysrhythmia. It manifests as a brief episode of loss or disturbance of consciousness that is with or without the accompaniment of convulsion and with sensory or psychiatric phenomena. It has a focal origin in the brain, and the manifestations depend on the sites of the focus. Epilepsies have been classified as generalized seizures and partial seizures. Now, generalized seizures is further classified as number 1, generalized tonic-clonic seizures. Now, generalized tonic-clonic seizures can be called major epilepsy. We can also call it grand mal epilepsy. It is the commonest type of epilepsy, which usually lasts for a period of 1 to 2 minutes. The usual sequence is aura, cry, unconsciousness, tonic spasm of all body muscles, clonic jerking followed by prolonged sleep, and depression of all the central nervous system functions. Number 2 is what is called the absence seizures. Now, absence seizures can also be called minor epilepsy. We can also call it petit mal epilepsy. It is usually prevalent in children and lasts for about half a minute. It is characterized by momentary loss of consciousness, and patient apparently freezes and stares in one direction, and usually there is no muscular component or little bilateral jerking. In this epilepsy, the EEG usually shows a characteristic 3 cycles per second spike and wave pattern. The third one is called atonic seizures. This seizure can also be called akinetic epilepsy. In this type of epilepsy, there is unconsciousness with relaxation of all muscles due to excessive inhibitory discharges. The fourth one is called myoclonic seizures. This is a shock-like momentary contractions of muscles of a limb or of the whole body. The fifth one is called infantile spasm. This can also be called hips arrhythmia. It is seen in infants. In this kind of epilepsy, probably it is not a form of epilepsy, but then there is intermittent muscle spasm and progressive mental deterioration. Also, diffuse changes in the interstitial EEG are usually noted. The second classification of epilepsy is partial epilepsy, which is classified as number 1, simple partial seizures. Simple partial seizures can be called cortical focal epilepsy. It usually lasts for about half to 1 minute. The convulsions are confined to a group of muscles or localized sensory disturbance depending on the area of cortex involved in the seizure, and it is usually with or without loss of consciousness. The second one is called complex partial seizures. Complex partial seizures can also be called temporal lobe epilepsy or psychomotor epilepsy. In this type of epilepsy, there is an attack of bizarre and confused behavior and purposeless movements. There are emotional changes lasting for about 1 to 2 minutes that comes along with impairment of consciousness. The seizure focus is located in the temporal lobe. The third one is called simple partial or complex partial seizures, secondarily generalized. In this type, the partial seizures occurs first and evolves into generalized tonic-clonic seizures with loss of consciousness.